Okay, my name's Shelby, and today I'm going to be showing how to do an NG tube insertion and also removal. So the first thing you're going to want to do, obviously, is hand hygiene. You're going to check off your basic checks, your rights. You're going to introduce what you're doing and inform what you're doing. You're going to make sure that you have your supplies ready. So you're going to want the tubing, tape, a paper clip, gloves, maybe a pad to put under them, water, and some kind of bag or something for it to drain into in case. You're going to move the bed into high Fowler's position, and when you measure the tubing, you're going to go from your nose to your ear and down to your xiphoid process. And so once you get the right measurement, you're going to put tape where that hit your xiphoid process at, and then you're going to put on your gloves. And before you start putting it in, you're going to wrap it 10 to 15 centimeters in your hand, and then release it just to loosen up the tubing a little bit. And you're going to place the tip of it in some lubricant, and you're going to give the patient some water. So before you start putting it in, you're going to inform them about different kinds of discomfort they can have, and if they're going to gag or choke. And then you're going to have them put their head back. And if you're right-handed, you're going to start on the right side, and if you're left-handed, on the left side. So you're going to put the tubing like at a down position, kind of going downward, and whenever you insert it, it's going to go laterally, and you're going to go all the way back until you reach the nasopharynx. And once you find the nasopharynx, you're going to feel some release or some resistance, and you're going to tell your patient to put their chin to their chest and take small sips of water. And as they're taking the small sips of water, you're going to keep inserting it 5 to 10 centimeters. And so once you get the tape up to the nose, you're going to stop, and to make sure that it reaches the stomach, you can aspirate or check their pH level, and you're going to connect the tubing to drainage, and you're going to tape it to the nose. And sometimes they'll have tape for you that's already split, but if not, you can take a piece of tape and cut it down the middle to where those two sides can wrap easily around the tubing. And so once you do that, you're going to secure the tube to the patient's clothes or bedding, as long as they're staying in their bed. And you're going to make sure the patient is okay and comfortable, give them another call light, and dispose of your gloves and supplies, and that's it. So then for removal, you're going to, again, inform the patient what you're doing, let them know kind of the steps to it, and put them back in Fowler's position. You're going to, again, get all of your supplies, cloth, something for the drainage, syringe, gauze, and you're going to disconnect the drainage and remove unfasten it from the gown or the bed or whatever. And then after you do that, you're going to take the syringe and draw back 10 milliliters of air into you're going to insert that into the tubing. And then you're going to put on your clean gloves after we've washed our hands and everything. And then you're going to make sure that you hold the gauze to their nose, so that whenever you pull it out, in case anything comes around with it, it doesn't just go all down their face. You're going to inform them about some discomfort that they could have, and so whenever you're getting ready to pull it out, you're going to wrap it around your fingers. You're going to have them take a deep breath and hold their breath and pull it out. So after that, you're going to dispose of your gloves and your supplies, and if there is any drainage that was still left over, you're going to document it, and Gonna give them any tissues if they need it, if they have some stuff coming out of their nose, and some water from them to drink. And then at the end, you're gonna place them in a comfortable position, get their call light, and make sure that you've gotten everything you need, and just make sure that they're comfortable.